due that just last spring with the PhD in statistics. His recent work focused on development of new formal demographic methods with a focus on using Bayesian as well. And he's going to talk about Bayesian population reconstruction.
Thank you. Okay, thanks very much for inviting me. It's very nice to have the opportunity to come back to Seattle, even though it is winter, but it's a nice winter, I see. We're having a bad summer in New Zealand, so this is actually nice. Okay, so as Haidong said, I'm going to talk about Bayesian population reconstruction. This is not a very good title, sorry, it's kind of long-winded. This is work that I did as part of my dissertation, so that was with my advisors, Adrian Raftery, Sam Clark, who are both at UW, and Patrick J. Lyons at the United Nations. Right, so, and I'm currently at Auckland University of Technology, which is in New Zealand. Okay, so to begin with then, just set the scene. So the kind of questions that we address here are very basic demographic questions. How many people are there? How many births? How many deaths? Just standard questions. So accurate estimates of these things, size, fertility, mortality, and migration rates in the recent past are essential for study of population. A quick note, I'm not going to be talking about forecasts into the future, so what I'll be focusing on is reconstruction of population parameters of the recent past, for example, 1960 up to 2010, something like that. Okay, so just to make that point. Right, so I'm sure everyone here is well schooled in all of these points. So these numbers are very useful as policy planning uses them, evaluation of programs, etc. They also provide a basis for forecasts and projections. Academic research and historical studies also require such estimates. So a source of such estimates is the United Nations publication World Population Prospects. So this contains demographic statistics for all countries. And in there are point estimates of vital rates, migration and population counts, and they go back to about 1950, and they go up to the present year. The WPP figures are particularly important for countries that don't have their own well-resourced official statistics systems. For countries that do, I think WPP tends to really just use the figures that they produce themselves. So the real benefit of this work and of WPP is for countries that don't have Census Bureau and whatnot. Okay, but the current WPP methodology achieves consistency among the estimates of the different parameters in what could be described as a manual and somewhat iterative process, so I'll describe that shortly. The estimates can be analyst-specific. There's no quantification of uncertainty, so this is kind of a key point and one that I'm going to hope to address here. By the way, if you want to ask questions as I talk, just shout out, that's fine with me. And I'll try and leave about 10 minutes at the end as well. All right, so, and I don't know if I can get rid of that. Nope, didn't want to do that. I was going to get rid of that little, oh, cripes. I knew I would make it worse. All right, I'll just have to bear with that little box. Okay, so quantification of uncertainty then is important because sources and reliability of data vary greatly among different countries. So vital rates, for example, in more developed countries, there are vital registration systems. These have high coverage, low bias, usually, and low measurement error variance. But where that's not available and you have to rely on demographic and health surveys, that's not the case. Bias can be high, measurement error variance can be high. You can have incomplete coverage, whatnot. So expert knowledge about standard demographic processes, typical values of these parameters, and also knowledge about the data sources themselves becomes very valuable. Then you have to sort through what you've got, decide which may or may not be reliable. So this is an example of data on total fertility rate for Burkina Faso from 1960 through to 2000 from various different sources that I've put together. So you can see that, especially in this period here, there's disagreement amongst the different data sources as to what the value of this parameter was. So summarizing this information with a single estimate in each year, so essentially just putting a line through this and then having done with it, is not really telling the whole story there. So there's something else going on that we want to try to account for. So that we might try to account for this, what I've referred to as disagreement amongst data sources. We might build a probabilistic model that uses uncertainty to reflect the nature of the data that's available, or the information that's available. Okay, so here's some screenshots from the internet. It's got a picture of a baby. So about a year and a half ago, 2 years ago, there was a 7 billion day where the population was supposed to reach 7 billion. There's a lot of press about it. But then I found this, which I thought also tells really what's going on. You know, we may not know exactly how many people there are. Okay. So yeah, the goal was to come up with an improved method for reconstruction of populations that, as I've mentioned, quantifies uncertainty probabilistically, estimates parameters consistently, one that's easily replicable once it's set up, you've got the inputs prepared, and that uses all reliable data as well as expert opinion when it's needed. Okay, so I'm going to go ahead and explain the model and show some examples. So before I do that, let's just put down some notation. I'm just going to be looking at things by age and by time. So I'm just going to use age. I'm referencing age with an A. Age groups are going to be of width 5 years. We'll end at 80. Time periods are going to be referenced, indexed with a T. T naught is going to be the first year, or the baseline year. And I want to reconstruct the population over the period T naught to cap T. So that might be, so T naught might be 1960, cap T might be 2010, for example. I'm going to call these things input parameters. The input parameters to the model are going to be fertility rate, age-specific fertility rate by time period, survival proportion, so that's this parameter I'm using to reflect mortality. And then I'm just going to use a G for migration to avoid confusion with the letter M. And N I'm using is the count. And then in addition to those age-specific input parameters, I'll also talk about the summary parameters. So for fertility, I'll use a total fertility rate. And for mortality, I'll use life expectancy at birth. So the point of these are sort of subpoints is that both TFR and E naught are just simple functions of the age-specific input parameters. So we don't need additional information beyond the age-specific input parameters. Okay. Like what would make someone count as an international migrant, for example? Yeah, it's from out. So this is all going to be done one country at a time. So anyone who moves into the country, permanent or long-term, would be an international migrant, an immigrant. Anyone who leaves will be an emigrant. But I'm just going to use net international migration. So it would be immigrants minus immigrants. At the country level, that's right, yes. By age and by time period. Well, I'll do that. There isn't actually very many. Yeah, one more question?
No, go ahead and see what the model is.
Okay. So the fundamental relationship that links all of these together is this demographic balancing equation. So the number of people who are around at time t plus 5 is the number who are at time t. Add in the births minus the deaths, and then add net migration. So this is a deterministic rule for projecting populations forward in time, so forward from our baseline, so forward from, for example, 1960 through to 2010, if that's the period we're looking at. If you do it by age, it's this cohort component method of population projection. If you express it, it's a big matrix expression, so I've not put that there, but it's the same idea. You just have to keep track of all of the different age groups. So this is a discrete time approximation, and this is a standard procedure anyway, so you can.
So now I need to ask one question. You use piecewise constants for all your functions, right?
Yes.
But you haven't written out the equations. I have to ask.
Okay, well, it would be the average, for example, for fertility rate, it would be the average over a set period of time, but the average fertility rate over that period of time. So if it's 5 year by 5 year by 5 year, So it would be the average rate over the 5-year period. So it would step up or down as we go forward in time, yeah. Okay? I'm not specifying any functional form with respect to time or with respect to age. Yeah. All right. So given that we have fertility, mortality, net migration over our period of reconstruction, and population counts in the baseline year, we can project to get population counts at the 5-year steps using just baseline population and vital rates. In addition to that, we have censuses. You probably will have censuses at certain years in this reconstruction period. And the two counts can then be compared. So you can compare what the population should be based only on baseline counts and vital rates and what is recorded in the censuses. There'll almost certainly be some difference. So you can use the difference between those two things to make inference about data accuracy. So that's basically the gist of what I'm going to show. All right. So the current practice to producing WPP this is my summary. So this is my understanding of what goes on. They gather all available data. So that's what's happening here. All of the available data is collected. They are put into what I'm calling a pre-processing step to get a single initial estimate for each age in each time period. And then they do that projection as I described. Once the initial estimates for all of the parameters, the input parameters to the projection method are determined, then the projection is made, and the analyst checks to see if the projected counts are consistent with the counts that were observed in the census. If they're not, manual adjustments are made to all of the inputs, and then this is repeated until consistency is achieved, and then these are output. So this pre-processing stage is done to reduce parameter and source-specific biases. So this would include, for example, discarding some data completely or using indirect estimation techniques. So these indirect estimation techniques are such things as correcting for biases due to omissions of births and deaths or misplacement of births. So the PF ratio for estimating fertility is one example, or perhaps you would need to use a relational model to smooth estimates of mortality. The cause and the magnitude of biases vary greatly among the data sources and parameters and time. So because of this bias reduction step is source and parameter specific. It relies on detailed knowledge of the data collection methods and possible sources of bias. So I've we've not attempted to replace this step because our goal was to try and come up with something that would apply in a very broad range of situations, so in a very large number of different countries and over different periods of time. So we're not trying to change any of these methods here. Okay, so to summarize then, so under the current practice, the raw estimates which are subject to biases are put through this pre-processing stage, or indirect estimation techniques are used. So this means that once this is done, most of the available data points are kind of already modeled. So just take those as those initial estimates. Consistency among the parameters, as I showed, was achieved in this manual iterative fashion, and then there's no quantification of uncertainty in there. So in the method we propose, it's designed to be consistent with current UN practice, and it takes those pre-processed initial estimates as bias-reduced input. And then the consistency among the vital rates and the census counts is formalized by incorporating the cohort component method of projection into a statistical model. Okay, and in the model, then the parameters to be estimated are the same as those input parameters. So it's the population count at baseline, the fertility, the survival, and the migration parameters. And again, this is going to be done over a set reconstruction, a set period of time. The error variance here is modeled statistically. Okay, so I'm going to go through a few examples. To begin with, I started out by looking only at females, and we'll get to males a little bit later. So everything up until I say is just females. Okay, So here is a summary of the two different approaches. Current UN, so this is a diagram I showed before. The new method, I've summarized it here, steps in once these initial estimates have been determined, once this pre-processing has been done. The initial estimates are put into the hierarchical model, which I'll show next, which defines a posterior distribution, and the results are based on the posterior distribution. All right. So this is the hierarchical model. It's got 4 levels. So if I start at level 3 here, the true vital rates, which are indicated here, so this is a model for these vital rates and migration. These have priors conditional on the initial estimates, so these asterisked quantities serve as fixed prior medians. These are the initial estimates that come out of that pre-processing stage. Also, these sigma squareds, these variance parameters, account for measurement error, which are themselves given in the hierarchical framework. They're given their own distribution here at level 4. In level 2, the priors on the vital rates and the baseline counts. So these priors induce a prior on projected population counts because these can be input into cohort component projection. All right. And then level 1, this is a likelihood for the census data, n star, the census data. So this is where we do the comparison between the census counts and the counts that are derived by projecting the vital rates from the baseline. All right. So these are the things that we have data on. These are these initial estimates. These are the things that have to be specified. So I need to specify hyperparameters for the variance parameters. And then I do inference on these things here. So I'm going to get a joint posterior distribution on these things here, including this as well. Yeah?
Why did you choose to use normal distributions for the counts?
It seemed like a sensible option. And it allows me to use the Gibbs sampler to do my MCMC. It's a log normal, so because they have to be positive, so I put on the log scale.
When you showed this data from fertility and the process, does it show up in this model, or is there the pre-processing step to go from that to your?
That's right. So the pre-processing step is in between, and then so that would yield these F star quantities right here.
So you want to tell me how to draw a line through that?
That would be up to you to learn. Yeah, you'd have to read about the data and then decide which are reliable, which are not. Yeah. Okay. So the next slide is sort of a repeat, but in a different way. Oh, any more questions about? Nope. Okay. So this is just a re-expression of that model, if you prefer, in a more diagrammatic form. Same thing. So the inputs, which are these initial estimates here. So on the vital rates, they go into the projection to give projected counts. Census counts are also input, and they define the posterior distribution. At top, I've got those variance parameters. Okay. So those variance parameters are used to model measurement error variance. These are random variables, and they reflect non-systematic error in the initial estimates. Alpha and beta are the hyperparameters I have to specify, so I chose to specify these using expert opinion, which could be informed by empirical estimates of measurement error if that's available. Usually it's not, so instead of eliciting values for alpha and beta themselves, I turn it into this more intuitive question, which is with probability 90%, the initial estimates, which are those asterisk quantities, are accurate to within approximately plus or minus p%, where I ask for a value of p, or I elicit a value of p. Okay, so this approach was flexible because it applies to situations in which there's no information about data accuracy, but if there is, then we can use it to set those hyperparameters. Okay, so to summarize, the inputs are bias-reduced initial estimates of the age-specific vital rates and migration and the population counts. And in addition, expert opinion about measurement error variance, which I could base on data if it's available. The output is in a joint posterior distribution of the inputs. And from this joint posterior distribution, I look at 95% credible intervals for those parameters and any transformation of those. Okay, so I'll quickly go through this, a little behind time. And so I did do some checks to make sure this sort of worked as expected. You can check calibration of the intervals, as in do the 95% intervals contain the truth 95% of the time. You can also look at whether you get an improvement over the initial estimates by using the posterior medians as point estimates by running a little simulation study. So I just generated a small hypothetical population. I used the model to generate my initial estimates. I reconstructed the population many, many times, so I didn't come across no problems were revealed, so coverage of the 95% intervals appears to be 0.95 as desired. We did get a little closer to the truth by using the posterior medians. And I also compared the model with a slightly more flexible one where I allowed one of the variance parameters to vary by age and time. It didn't appear to be necessary. So I left it as it is. Okay, so on to some examples now. So I tried this out in a few different situations. So what I'm going to show here is I'm going to compare the application of the method to two different countries that have very different sources of data. So as I said, this exercise is most useful in situations where data is fragmentary and unreliable, so you've got a large amount of uncertainty. So it's useful to know or to have some estimate of what that is. But here I'm going to show that it also works for countries with good data by reconstructing female populations for New Zealand and for Laos, which has more fragmentary data. There are different reconstruction periods, which is just determined by the available data. But the population sizes of these two countries is similar. So these are the female populations only. So they're both small countries with comparable populations. But the data quality and the availability of data are very different. Okay, so the data sources and the initial estimates for Laos, I've sort of summarized it in this table here. Population counts are available in censuses these years. These were adjusted for bias due to undercount. Fertility comes from birth history surveys, as does survival information, and so indirect methods and smoothing were used to pre-process the fertility, and model life tables were also used to pre-process the survival data. For migration, I didn't use any sources on migration. It wasn't easy to find anything that was comprehensive. So for migration, the initial estimates were set as 0, and then I put a larger relative error on there to indicate that uncertainty about migration a priori is higher than it is on these other parameters. For New Zealand, there are censuses at more frequent intervals. The accuracy of the censuses is estimated using post-enumeration surveys. There's vital registration for fertility and survival. So these estimates of relative error are based on studies of the accuracy or the coverage of these instruments. So this is where if you have information on the accuracy of the sources, you can use it to specify this relative error value. Information on migration, when you arrive at the airport or leave, you're required to fill out a form and state your intention. And from that form, it's determined whether or not you're a permanent long-term migrant or not. There's some error associated with that because there's no one checks to see if you actually do what you say you would do, and so there's a larger relative error attached to the migration data. Okay. So looking at the results for total fertility rate. So in all of these plots here, I've got Laos on the left and New Zealand on the right. Total fertility rate's on the vertical and time is on the horizontal. The red or pinky colored symbols and lines are the prior distribution. The solid red line here, this is the prior median, so this corresponds to those asterisk quantities, that's those pre-processed estimates of fertility. The blue or cyan corresponds to, is the posterior distribution, and the line is the posterior median. And then these bands are the 95% intervals. So this is a central 95% probability interval for the prior, central 95% probability interval for the posterior here. Okay. Unsurprisingly, fertility is lower in New Zealand than it is in Laos. But also the posterior uncertainty in New Zealand is also lower than it is in Laos. And if you look at the the mean half width of the posterior intervals for New Zealand, they're about less than a tenth as wide as they are for Laos. So the uncertainty in the posterior is quite a bit smaller for New Zealand. I've compared them here with the WPP figures mainly to make sure I didn't do anything silly, to make sure they were sort of in the ballpark. So this also shows you where WPP figures fit. There's no reason why they should be the same, although they are based on similar data sources. Okay, so that's TFR. I can get age-specific mortality rate. So even though my input parameter for mortality is survival, given that I have a sample from the posterior distribution for all of the fertility, survival, migration, and the baseline population, then I can convert that using a standard life table method into mortality rate. So here again, the same prior and posterior for mortality rate for Laos and New Zealand in a single year. This is 1985, this is 1986. Again, if we look at the mean half widths, the posterior uncertainty in New Zealand here is about a sixth that of Laos. And then this is migration. So for Laos, you can see I set the prior median to be at 0 and the prior uncertainty to be very large. For New Zealand, the prior median follows the estimates from those immigration cards, and then the posterior makes some small adjustments here. And also the amount of uncertainty in the posterior is greatly reduced as well. Do I have that? Okay, so not as much of a reduction in this mean half width, but still noticeable. Okay, so to summarize that example, the posterior credible intervals were much more narrow for New Zealand than they were for Laos, which reflects higher data quality. The method works for countries that have very good data as well as those that have fragmentary and unreliable data. Whoops. Okay, well, that's it. Okay. So, as I said, that was for females only, so that's where I started with. But now I'm going to show you how I can do this for two-sex populations by doing this two-sex reconstruction. Okay, so to do it for two sexes, you have to extend the cohort component method of projection because that's required, that's a part of the model. And I need a two-sex version of the hierarchical model. And as a consequence of including males, not only can you obviously estimate things like male mortality, male migration, but you can look at sex ratios in populations as well. So you can look at sex ratio of birth, sex ratios of mortality, for example. Okay, so the two-sex cohort component projection, I use the standard method, this female dominant projection, in which all births depend on female fertility only. So essentially you do most of it separately for males and females at ages above 5. In my notation, I'm just adding I'm adding L to index sex. F is female, M is male. So I've got sex-specific versions of all of those input parameters, apart from fertility. The total number in the youngest age group then is calculated from the number of births, which is a function of fertility and survival. And then you also add in this parameter sex ratio at birth at each period of time to separate the births between males and females and apply mortality and migration as well. So we compute all sex births first, decompose it using sex ratio birth because I want to make inference about this parameter later. Here's that model again. The additions are shown in red, so I'm just making everything but fertility sex specific. I'm also adding in sex ratio at birth here. So this is log sex ratio at birth has this distribution. So this is a model for the log odds that a birth is male. I also need a variance parameter for sex ratio at birth, so that goes in here. Okay. Okay, so I decided to have a look at sex ratios in India over the period 1971 to 2001. So in most human populations, there are slightly more males at ages below 30, slightly more females at ages above 30. Usually, female life expectancy is higher than males, and the sex ratio at birth typically falls between this range, in the range 1.04 to 1.06. 1.04 to 1.06 males per females in the births. In India, it's believed that males outnumbered females even at older ages at points in this time period. Estimates of female life expectancy have been lower than that for male. And since the 70s, some estimates of sex ratio at birth in some areas have been above 1.06. Some regional estimates have been a long way above 1.06. So it seems that they're a little outside the range we would expect. This has been attributed to a few things based primarily, I think, on a cultural preference amongst parents to have sons over daughters, which is manifested in higher female mortality pre-1970 and higher sex ratios at birth post-1970s. Okay. So what I'm going to do is apply this Bayesian reconstruction to help answer some probabilistic questions about sex ratios. So two such questions are, what's the probability that sex ratio birth was unusually high between 1971 and 2001, and has sex ratio birth increased in India since 1971? All right, here's this table again. So data for India comes from censuses, which are at 5-yearly intervals, again, adjusted for undercount. There's information on fertility survival comes from the Indian sample registration surveys, national family health surveys. For migration, I just used what I did for Laos. I centered it at 0 with a large relative error to reflect the lack of information about migration. Sex ratio birth information comes from sample registration system in the health surveys, same as fertility. Okay. And these were pre-processed as I described before. All right, so this is results for sex ratio birth. So our question about the level of sex ratio birth is here. So again, the pink red is the prior. This is the prior median in red solid line. The posterior is this cyan color, this blue color, with the posterior median indicated with a line again. And these dashed lines are the typical range for sex ratio birth. So this is 1.04, this is 1.06. Okay, so I can then use my posterior, this marginal posterior distribution for sex ratio at birth to answer the question, what's the probability, to estimate, sorry, the probability that sex ratio at birth was above 1.06 in each of these years. So here is this table here. You can see in 1971 it was about was estimated to be 0.44. And then in here, this is estimated to be 0.96. So these years indicate the year that begins a 5-year period. So this 1996 is the period from 1996 through to 2001, for example. Okay, so this is sort of just to demonstrate what's going on in the background. The posterior, this sample that I've drawn from the posterior distribution consists of lots and lots of separate traces like this. And so in order to estimate these probabilities, for example, the probability of being above 1.06 in the period beginning 1991, I just look in the posterior sample and I count, I'll look at the proportion of the trace of the points that are above this line in the posterior. So that's how those are calculated. All right, so for the trend, I want to know whether there was an increase in this parameter between 71 and 2001. So I need some quick way of summarizing the many thousands of traces that are in my posterior. For each trace, I need to decide whether it indicates an increase or a decrease, and I need to do it quickly. So what I did was I did sort of two different ways of looking at it. One was to fit just a very simple linear model to each of those traces, and then look at the slope parameter. Or I just simply look at the estimated value in 96 and compare it with the estimated value in 1971. Okay, so here's a picture representation. I've just taken two of those. So this is fitting. So for each of these traces that is one element in the posterior sample, you just fit this linear model. Look at the slope parameter. That's another one there. So if either of these are positive, that indicates there was an increase in that particular element of the sample. So the proportion that were positive of these slope parameters is 0.93. So that can be used as an estimate of the probability that there was an increase in sex ratio at birth. If you just use the two endpoints, you get a similar result. Okay, so then what's the probability that sex ratio at birth was unusually high between 71 and 2001? Well, probabilities are estimated to be, 0.93 in this period, 0.96 in the final period, and then lower in all preceding periods. In terms of an increase, so under both of those measures, the probability of an increase was bigger than 0.9. Okay, so finally, if I do the same thing for life expectancy at birth, what's the probability that female life expectancy was lower than males? What's the probability that the gap decreased? So this would indicate things returning to or moving towards something more common in other countries. So same thing for life expectancy at birth. The probability that female life expectancy was lower than males was very small at most of the over the period, and it was 0.79 in 1971. So that's less than 0.8 in 1971. Okay, so if I repeat the trend analysis, if I do that OLS thing and looking at the two endpoints again, my estimates for probability of an increase are very high. So an increase in the difference. So that means female life expectancy is increasing with respect to that of males. Okay, and to summarize then my questions here. So female life expectancy was lower. So in this period that I looked at, there wasn't strong evidence that female life expectancy was lower than males, except perhaps in this very first period here. There was very strong evidence to suggest that the gap between male and female life expectancy has reduced since 1971. Okay, so summary point, Bayesian population reconstruction in this two-sex version can provide probabilistic answers to these meaningful questions about any kind of transformation of these input parameters. So sex ratio of birth is an input parameter, but sex difference in life expectancy or sex ratio of mortality rates, all those sorts of transformations are easy to get at. You just, once you've got this posterior distribution, you can just transform each of those individual traces. Okay, so summarize. I guess I'm a little ahead of time. Okay, so Bayesian population reconstruction then is a new method for reconstructing population structures of the past. The inputs are biased reduced initial estimates of age-specific vital rates, net international migration, and population counts, as well as expert knowledge about data sources and measurement error variance, or if there's information about that, you can include it too. The output is this joint posterior distribution over all of those input parameters, those age-specific input parameters. Improvements over existing methods, so for example, the current method of producing WPP, are that quantitative estimates of uncertainty are expressed, and they're expressed probabilistically. Trends and uncertainty are estimated coherently with respect to the projection model, so I'm using that cohort component method of projection to ensure that I have coherency amongst the vital rates and the population counts. The estimation requires a single run over the inputs, so there's none of the manual adjustments that are required once the inputs have been determined. It works across a range of data quality contexts, as I showed with Laos and New Zealand. It's now able to produce two-sex reconstructions, and so you can look at any kind of transformation of those input parameters, derive answers to probabilistic questions about those. And I have a quick note. There's three main references. This paper is in Journal of the American Statistical Association. And then there's two CSSS. So CSSS is Center for Statistics and Social Science at the University of Washington. There are two working papers, 117 and 138. And also there's a package on CRAN, which is the repository for this software package for R. It's called Pop Reconstruct. All right, that's it. Any questions? Yeah.
For your trend analyses, why did you choose to model simulated data rather than actually modeling the trends?
When you say simulated data, what do you mean?
Well, you showed the trace plots. You drew new values from the posterior and then did your OLS
Oh, right.
estimation of that, rather than modeling the trend as a function of time within the model.
Ah, well, okay. Well, I didn't want to specify any particular functional form for the time trend in the model. So these traces are not. I mean, this was intended to simply summarize the trend that is in the posterior, not. I mean, like I said, I wanted to know, does each trace suggest an increase or a decrease? And I wanted to have some sort of automated way of sifting through each of the traces that makes up the posterior without having to sort of do it myself. So but I didn't want to have that in the model to restrict, say, it to have any particular functional form like a linear increase or a quadratic or anything like that.
But then as you draw these traces, from what I see, I assume that you assume that the deviation from the average trend is independent over time. There's no correlation over time.
There's no correlation specified in the model. If you were to go and look at if that was present in this posterior, there could be. It's not specified in the model. So there's no restriction on what that correlation could, need be in the model. These age-specific and time-specific values are free to, vary at each. In each of these traces is a single sample from the joint posterior distribution, which is joint over all parameters, all ages, and all times. And each of those single ones, there's no specified correlation amongst them. But that's not to say that in the posterior there isn't correlation amongst them. There probably is. They're probably correlated. Probably in this case, it's probably the case that there is a correlation in time in the posterior. But so you could go back and have a look at an estimate of that using the posterior, but it's not specified. Hi. Yeah.
Can you tell us a little bit about how you do inference on these? How long does it take?
Okay, so it's a reasonably standard MCMC using reasonably standard proposals. There's not a great amount of innovation there. It does take quite a long time because there are many parameters. It's written in R, which is interpreted. So, for example, this Indian one took, I think, maybe 3 days or 4 days on like a regular desktop machine. Yeah, so that's sort of an idea of how long it takes. Yeah.
Are all your inputs nationally representative, or are you able to combine subnational data sources with different relative errors to produce a national estimate for each parameter?
It's all at the level of the country. So what goes in as those initial estimates should be nationally nationally representative. There is no. I haven't given any methodology for combining data which is just subnational with national. You'd have to go through that in the pre-processing stage. Yeah. Okay, that's a good question. Yeah, there will be some sensitivity there because that information is useful in the model. Given the nature of the data themselves don't have much information about themselves, and so those priors are, that's information that's needed in the estimation process. So the idea is to come up with something that is actually a good estimate. So in the New Zealand case, for example, it was easy because there are post-enumeration surveys that are done, and it's quite, you can kind of rely on those elicited mean relative errors. In the case where that's not available, it comes down to relying on the expert knowledge of the demographers who know the data sources and are prepared to state that that's a reasonable estimate. Yeah. So if you do change them, then the results in the posterior will be sensitive to changes. So it's important that you have a good estimate of that. Yes, that's right. Well, so that's what would happen if you allow those variances to vary by age or by time. Then, yeah, you would have different relative errors for different age groups, for example. It was a while ago. What did I do? No, I left it the same. Yeah. So you might, if you have strong, if you do have good information about how those things do vary over time, then you could try introducing those extra parameters. It may not make an enormous amount of difference. I think you'd have to sort of you could do it. When I tried it, it was hard to discern any difference between the model with only one variance parameter and the model which had variance parameters varying over age and time. So. Okay, have I added information on HIV? No. At this stage, you would have to build that in when you come up with the initial estimates for survival and mortality. There is, if you wanted to look at prevalence of HIV or something like that, or even incidence maybe, you would probably have to use the HIV-enabled CCMPP, for example. So that's one way of building it in. It's probably quite complicated because you didn't have an enormous. You'd have a lot more parameters. That's the most sort of obvious way I can think of building it in there. Yeah, you'd need separate data though. You need to have some data that would tell you HIV-related deaths versus, non-related deaths. So the uncertainty in the prior is based on that elicitation step. So you have to specify, if I zip back, punch it here. Okay, here. Okay, so yeah, these are the mortality parameters. They depend on this variance here. So this reflects the uncertainty in the prior, and then you need to specify distributions. So specification of these relies primarily on expert opinion. You come up with the initial estimates. You say, right, well, is it what with probability? So with a probability of 90%, are these initial estimates within plus or minus 10% or 20% or 30% of what we think the truth really is? If you do have information about that measurement error, as was in New Zealand for the vital registration, then you could either use that to specify these parameters. If you wanted to make it more complicated, you could build a model for this stage here, which is based on your estimates of inaccuracy or accuracy in the data. But that sort of information really isn't available. If you had one way you could think about doing it is perhaps if your survey has some estimate of the inaccuracy or something, but you've got to be then thinking, well, if there are multiple different surveys, you have to think of a way to combine the margin of errors from different surveys. So it gets quite messy. It's hard to do that in a way that would apply quite smoothly across lots of different countries. Yeah. I haven't looked in it in great detail. Migration always seems to be the one that there's no information on it at all. It sometimes gets put in the too hard pile. We found that this centering it at 0 and just allowing for quite a large amount of errors seemed like a sensible prior, and moreover, even when you did that, when I did that, am I going wrong? And posterior, for example, even though we set an enormous amount of, a very wide prior, we still got like a sort of a reasonably tight posterior in here. So, yeah, I haven't looked into it in enormous